Welcome back to KTN News Center. And just as I promised you before taking that break, talking about COVID-19 and the issue of oxygen here in the country and in Taita Taveta, actually the installation of a medical oxygen bulk storage plant in Voi County Referral Hospital has been delayed over an paid 2.6 million shillings fee. Now, Taita Taveta County Health Executive John Mwangeka said the contractor supplied the equipment on March 13th, but declined to install it due to the outstanding fee. He spoke to Hezron Kimari on the standoff and what it means for the fight against COVID-19.
Well, as the country currently facing a shortage of oxygen, especially Kenyatta National Hospital, also in other regions, we'll be focusing on the same. And now in Taita Taveta County, now I'll be joined by the chairperson, County Assembly Committee of Health Services, maybe to share with us the status in this county, him being the chairperson. Mheshimiwa, welcome to KTN News. Maybe give us a brief status update on where are we in this county concerning oxygen and also ICU beds.
Currently, we have a lot of issues which are ongoing right now. The oxygen plant already is with us here at the hospital already. Just awaiting installation, just a few items so that it can be fully installed. This oxygen, we've been promised within the next 2 or 3 weeks that the oxygen plant will be up and running. And already we have bought enough gas tanks. We have nearly 100 gas tanks as we speak today. And this will actually curb the shortage that we have in terms of our facilities, basically. And we are also looking forward to any surpluses that we'll ever have that we'll be able to share with the other private institutions that we have around here, because they also become again our responsibility, because as people miss places in the county referral hospitals, then most of them will always flow back and go back to the private facilities. So as I speak today, also I sit in the county emergency COVID committee that actually is focused on the issue of ensuring that the safety measures that we have put for COVID are up to date. A week ago, we had a meeting on the same issues, and already we agreed that all the structures that we had before have to be reactivated, and they should start operating as soon as possible. So the sub-county ones have started already working and ensuring that people follow the COVID rules as they were from before, and become a little bit more stricter, because we have seen some other counties shut down just because of the issue of COVID.
Maybe just to speak about oxygen availability or yes, the oxygen plant. We understand this project has really taken a long to materialize. Yes. Why taking so long?
Yeah, the contractor was given the work to do, actually was sourcing the oxygen plant from France. And we gave him the contract just when we got into the COVID era, when it started last year. And most of the companies, as you know, France is one of the places that has been hit hard by the COVID-19. And so we had to give them extensions to ensure that they bring them in due time. It is my hope that now, because we have the machine and we wanted a machine that of a certain quality, that we will be able now to achieve what we had geared to do.
Maybe as in, when did the machine arrive here in Taita Taveta, and why hasn't it been installed until now? And which is very important services to the residents.
We had an official meeting with the CEC in charge as members actually of the county assembly, and he managed to come and visit us at the invitation of the committee. He visited us in Nundanyi at the county assembly chambers, and one of the key things that he still needed our support is to ensure that the same contractor has different bills, and you know the issue of pending bills has become a thorn in the flesh. And up to now, we are still focusing and waiting for funds to trickle in so that we can be able to not only pay him, but also to pay the people who had actually done activities before on COVID, whose allowances are still in arrears in our county.
So you mean the oxygen plant will not be installed, or the machine will not take place, or will not be active until the contractor or the supplier is paid some of the balances?
Yes, that is what he termed as part of his agreements, that basically we need to pay him a certain amount because importation of the machine, it has a cost, and then after he has imported it, he needs to install it again, and then that also has a cost again on the same side. But we have asked also the Department of Finance to be able to facilitate up to maybe 2.6 million shillings to ensure that it's actually paid to this subcontractor so that he can pick up on the issues as fast as he can. So we are still awaiting from the CEC of Finance to be giving us an update on what should happen.
So, well, still talking about the status of COVID-19 and all the preparedness in this county, we understand the national government is sending some money to this county. Maybe you being the chairperson of the county assembly and committee of health, can you give us a brief update on what status are we now, that how were the money spent? Because we are seeing there kind of allegation that some money were actually misappropriated.
Maybe to highlight on the report that people are seeing on social media all over around, which you haven't received for us as a county officially. There is a tendency that most of the people think that all the audit queries, when they are being asked, it's an issue of a misappropriation. For this one, actually, that's why we did not even feature in the first report that was done on the same issues of COVID as a county, because apparently there were only some issues of how procurement was done to what level. Yeah, and if there were any issues of negotiation, how they were done. That was the bigger issue. But about misappropriation of funds, no. There was nothing like misappropriation of funds. Funds were actually paid to the persons who were meant to be given the same funds. So we are still waiting for that audit report to touch down if it's going to be coming to our county assemblies. I sit also in the Public Accounts Committee. I'll be very eager to know where all this money went, which is being alluded to or being said that it has happened. So, yeah.
Okay, thank you. Many thanks to you. That was the chairperson, County Assembly Committee of Health Services here in Taita Taveta County, Honorable Omar Ahmed, and also the MCA Caroline Ward, talking to us just briefly about the status of health services in this county, and especially under this time when this country is being faced by third wave of COVID-19. Reporting for KTN News from Voi, I'm Hezron Kimari.
Hezron Kimari, thank you so much. And as the country